13 a.m. Today marks 3 years since the COVID-19 outbreak was declared a pandemic by the World Health Organization. Now, while the debate over the virus's origins continues, experts are still learning about its long-term health effects. We're joined now by epidemiologist DeWolfe Miller. He's one of the experts who worked on the state's emergency response. Now, 3 years later, DeWolfe, good to see you. Everything seems back to normal, but where are we now in this pandemic? Is it over?
Not quite. We're still seeing cases, and there's still people being admitted to hospital with COVID. It's obviously much less. So hopefully this will not increase. It'll continue to decline.
Well, what are some of the lessons that we've learned? What measures have actually been put in place as a result of this public health crisis?
Vaccines. So we've learned to make really good vaccines. I've spent a good deal of time in my career actually making vaccines myself, and I'm an infectious disease epidemiologist. So to see these RNA vaccines to come out in the time that they had to come out, they saved a lot of lives. And I hope that in the future that this will become more like influenza. So in the fall, we will get our flu shots, and we'll get our new updated coronavirus shots, perhaps even in the same injection. The key here is to get them. It's one thing for a person to get their shot and be immunized, which is a good thing, but to have the community to participate the larger the community that participates, the better off we're going to be as going forward.
Well, many do continue to reject those vaccines, DeWolfe. I looked at the numbers recently, 79% fully vaccinated here in Hawaii. Only 20% actually got that Omicron booster. What more can we do to really protect ourselves or encourage people to get vaccinated?
Maybe having programs like this to continue to remind people how important it is that this is a collective effort. It really works. These vaccines really works a lot better if you have the major part of our population immunized. One person protects themselves, protects the people around them, but collectively you get a dramatic increase in community protection, which helps us all continue to have pretty much a normal life like we're seeing now. Excuse me.
Okay.
And so it's just so crucial that we continue to encourage people to get their flu shots, to get other immunizations that they might need, and the new upgraded coronaviruses as they come out over time, as they most likely will.
Okay, well, we ran out of time, but I just wanted to, again, ask you and people out there about being aware of the variants that are still out there and looking out for the next threat. Any just like last-minute advice before we go to break?
Well, you can also, in addition to being vaccinated, when you're in crowded spaces, wear a mask. Certainly, we have in Honolulu a lot of elevators and other places that you might be in with big crowds, and so wearing a mask is also helpful.
Okay, good tips there. Thank you so much for joining us this morning. DeWolfe Miller there.
My pleasure.
Epidemiologist.
Thank you.